Okay, so first we're going to check the accuracy and completeness of the MAR, confirm allergies, which is only codeine, and assess medication and health history. Okay, so we assessed the patient's build. He's an average size adult weighing about 150 pounds and his height is about 5'5". Okay, so today we're going to be doing an IM injection. We've chosen a 0.6 millimeter gauge and then a 25 millimeter length. We've chosen this because the average gauge for an average size adult is 0.9 to 0.5, and then the length is 25 to 38 millimeters. So these fit the appropriate ranges for Mr. Mancini. So for this syringe, we've chosen a 2 milliliter syringe because we are giving a dose of 0.5 milliliters. So before we assemble the syringe, we are going to do our hand hygiene. And then add gloves, and then we are going to assemble our syringe and the needle for the intramuscular injection. Oh my goodness. Okay, so then we're going to open the syringe. So now we're going to assemble the syringe. So you take the needle and just twist this on, and then leave the safety on until you have your ampule or vial ready. So then we're going to open the vial. You want to make sure that all of the liquid is in the bottom and none is left at the top part. And then you're going to take the top and then break it outwards. The dose ordered was 1 milligram, and so we divided that by what we had on stock, which was 4 milligrams, and then we're going to multiply that by 2 milliliters, and so that gives us our dose of 0.5 milliliters of Haldol. So we are going to draw up 0.5 milliliters of Haldol. So we've already opened our ampule. So we're going to take that off. Draw up the dose. To 0.5 milliliters. And then get all the bubbles out. And perfect. So now we're going to put the cover on the needle. So then you always have to correctly label your medication. So it's asking for the name, the room, and the time, date. So you're always going to write the patient's name, Mr. Mancini, the room number that he's in, the date, AM, PM, stable, and then you're going to want to put that on the medication. So you always want a landmark on your patient. So you're going to go from the back of the scapula in the front of the clavicle and get that, and then 2 fingers width, and then you want to go right in between your 2 fingers. So after drawing up the medication, before administering it to the patient, you have to compare it to your 8 rights. So you have to make sure it's the right patient. So you compare that against the MAR and the patient's wristband, the right reason. The drug was prescribed to the patient by the physician, and it is an anticoagulant. The right drug and the right dose, which you compare to the MAR at the bedside. The right time, the right route, which is an intramuscular injection. The right site, which we are inserting at the deltoid, and the right frequency, which is every 4 hours. So when giving the medication, you want to hold the needle like a dart, and then you are going to pinch wherever you want to give it, and then put it in fast. Give the medication, and then enter and let go of the skin. So we gave the medication at a 90-degree angle because it was an IM injection. So now we are going to cover the needle and properly dispose of it into this safe or sharps container. Okay, so we are going to be doing a subcutaneous injection now. I have chosen my needle, which is 0.5 millimeter gauge, which is in the normal ranges for a average size adult, which is 0.5 to 0.4 millimeters. And then the length is 16 millimeters, which is also within the normal ranges of 9.5 to 16 millimeter length. So according to that, it is in Mr. Mancini's range. Okay, so now we are going to perform our hand hygiene before we get our syringe and needle ready for the subcutaneous injection. Apply our gloves. Our needle. The needle is already attached to the syringe, so we don't have to worry about preparing that. So now what we're going to do is we are going to open our ampule. So you're going to want to take like an antiseptic swab just to hold the top of the ampule so that you don't cut your fingers. So you're going to take the top of the ampule and break it outwards and then dispose of the top into the sharps container. So now you're going to take your syringe and uncap it, holding it away from yourself. There we go. So pull that apart, and then you are going to put it into the ampule without touching these sides. We're going to draw up the right dose, which is 1 unit. We're going to make sure that all of the air bubbles are out. And then once you see that little drop come out of the top, you know that there's no air left in the syringe. So then I'm going to recap it. Okay, so once you have drawn up your medication and covered the needle back up, you're going to want to correctly label your medication. So you're going to use Mr. Mancini's first and last name, the room number that he's in, the drug, which is heparin, the dose, which is 1 unit, and the time, which is now. So then once you've done that, you take your label and you put it on the medication. So now we are going to check a medication. So we're going to make sure it's the right patient, which is Mr. Mancini, and we're going to compare it to his wristband and his MAR. The right reason, it is an anticoagulant. We are giving heparin, which is the drug. The dose is 1 unit. The time, which is now. The route, which is a subcutaneous injection. The site, which is going to be his lower abdomen, and the frequency, which is once a day. Okay, so now we're going to take the needle that we've drawn up and we're going to open it from away from us. Before we give it again, we're going to check it against the patient's wristband to make sure it's the right patient. We're going to hold the needle like a dart. We're going to squeeze the patient's skin. We're going to give it fast at a 45-degree angle and then inject slowly. Remove the needle and let go of the patient's skin. We are going to dispose of the needle into the sharps container. We can now take off our gloves, and we want to document that we have given it and sign off on giving the medication.